Wearing masks in more indoor settings is a scenario 3 local medical officers of health in Ontario are pushing for, at least temporarily. Workplaces, schools, essential service settings like grocery stores and pharmacies have all been mentioned in a letter to Ontario's Chief Medical Officer, Dr. Kieran Moore, from the top doctors in Niagara Region, Windsor-Essex, and Peterborough.
The virus isn't gone, it is still being destructive. We're particularly seeing in our healthcare sector that there is a lot of activity that is burdening our health systems. Lots of impacts on children missing school because they're sick or isolating, people missing work because they're isolating. And we think we can do better. Masks allow us to continue enjoying our fully reopened society while making sure we better protect ourselves and especially those more vulnerable around us.
In the letter, Dr. Hirji and others say in each of our respective health units, we continue to see significant impacts that are not relenting during this 6th COVID wave. The return of masking could help protect those with inequities and vulnerabilities, relieve the pressures on our hospitals, and most importantly, protect the health of the people we serve.
Does there need to be a mandate in order to suggest that people put their masks back on when needed?
Yeah, so I think the last 6 or 7 weeks have really been an experiment to see would it be enough to not have the mandate. And I think unfortunately we are seeing the results of that.
They believe the directive needs to come from the province. Those are just 3 of the 34 local public health units in Ontario, though. And Toronto's medical officer of health says she doesn't think there's a need for more mandates at this point.
My advice to people, and if you've been listening to me for the last several weeks now, I'm encouraging people to use the tools and knowledge that we have available to us.
Those same tools that we've heard about throughout the pandemic: getting vaccinated, staying home if you're sick, and yes, wearing a mask but stopping short of being told to.
I am encouraging people to wear their masks. As you can see, I'm wearing mine. So when you're in indoor spaces with other people whose vaccination status is unknown to you, I think that this is a very reasonable course of action to take at this point in time.
The number of hospitalizations in Niagara and Peterborough are cited as reasons for reintroducing a mask mandate in some settings, saying the number of people with COVID has either matched or exceeded previous pandemic waves. At this point, Ontario does still have mask mandates in place for high-risk settings like healthcare facilities, long-term care homes, and public transit. That was set to expire on April 27th, but was extended until June 11th. Mark McAllister, City News.